typically we end up with some type of symptom. Let's say that maybe it's a back pain, okay? So if we have pain in our back, okay, what have we been taught to do? Bear, or we got a back pain, okay, symptom. And so we've been taught, okay, so what we do is we pick up a Bear or an Advil or something that's going to decrease our pain in the back. So we take a drug, and this actually decreases the symptom a lot of times, and so we feel better and we're really happy about that. However, here's the problem with that. There is still something that caused the pain that you had that has not been addressed necessarily. And that is the underlying reason why you have the pain. And what that's going to do, Freddie, over time is it's going to snowball. A snowball rolling downhill gathers momentum and it gets bigger. And so we're left with this underlying problem of being unhealthy. And so because we're unhealthy, and even though this symptom went away, now maybe 3 or 4 or maybe 6 months later, all of a sudden now we end up with, we got some knee pain, or we end up with some neck pain. So we end up with another symptom. We have to go maybe this time and take a stronger drug, maybe a prescription drug, and that finally knocks that out, and we're still happy about that. But the problem is we're still got this underlying problem that our body's unhealthy. And it's still snowballing. And so then we end up with, now all of a sudden we have a herniated disc in our neck, and we have neck pain and arm pain, and now we need not just a drug, but now we might need a surgery. And of course when they do the surgery, then they're going to also put you on antibiotics and do other things which are going to decrease the health of your gut, which is going to increase inflammation, which then increases pain. And now we've got 3 or 4 different drugs that we're taking. We've got a post-surgical scar tissue situation, and we still have not addressed this underlying problem right here. Do y'all see the problem? That's why you end up and say, well, how did I end up with that neuropathy? Or how did I end up with this pain? I never did anything. That's because you don't remember what you did 20 years ago when this actually started, or 30 or 40 years ago, right? And you don't remember all these other steps that we went through either, where your body was trying to tell you, hey, something's wrong here, something's wrong here. But we've been conditioned in America under medical care to just cover the symptom up and don't try to ask the question that you all need to learn to ask tonight, and that is, why? Why do I have the pain? Why do I have the symptom? And if you can get that answered, you have your best chance to recover completely and wholly, okay? And so, let me ask you a question now, okay, before we get into the slides. How many people believe, as a matter of fact, you're absolutely convinced that there is something that you can personally do in the next 30 days, let's say, to make your health worse? How many people believe there's something you could do to make your health worse? Raise your hand. Okay, I don't think there's anybody that's not absolutely convinced that they could do that. Hey, Lambert, come on in. Y'all can sit right up here, you and your wife, okay? So, the next question is a little bit obvious, isn't it? If there's something that you can do to make your health worse in the next 30 days, how many people believe there's something that you can do in the next 30 days to make your health better? Raise your hand. Okay, I think we're all convinced of that, okay? Now, here's the good news, and then I'm going to ask you to do me one other thing. The good news is, guess whose choice it is? It's yours, okay? Now, here's the thing I want you to do. I'm going to give you a couple seconds here, and I want you to think of 2 things right now that you can do to improve your health in the next 30 days. They can be simple, they can be complex, it doesn't matter. Just think of 2 things.
Stop eating sugar.
2, oh, don't share them yet, okay? She's already sharing. That's a really good one, okay? But just 2 things. It could be diet, it could be exercise, it could be something that you know you need to do about your health. Okay, while you're writing, let me tell you why I asked this question. And I want you to raise your hand if anybody in here thought or wrote down, I need to take more drugs. Did anybody write that down? I've been teaching workshop, Russell, for 20 years, and I've never had anybody that wrote down, I need to be taking more drugs to be healthy. But unfortunately, that's what we are stuck with a lot of times for our options. And y'all know no drug's ever been created to make you healthier. Drugs have been created to cover symptoms, but never to make you healthier, okay? So we got to get into something different. And so tonight I'm going to give you some options to what you've heard before as far as dealing with chronic pain. We're going to go into some of the reasons why you get it, and we're going to go into some of the solutions that we found and that other doctors have found that work really well, okay? So first of all, this is a little bit of just about my training, 23 years of practice now. I'm a certified, first of all, I'm a board certified chiropractor, a certified chiropractic wellness practitioner, board certified in integrative medicine, and a certified gluten practitioner, okay? So, studies in functional neurology and functional nutrition, functional blood analysis, studied with these doctors here, are well known, Dr. Tatis Karazian, Dr. Michael Johnson, and others. So, with that information I've learned, I'm going to share with you what we found works and what other doctors have found to work to deal with peripheral neuropathy and chronic pain syndromes like fibromyalgia. Maybe you've heard that. I had a fibromyalgia patient today, and she says, well, now, do I really have fibromyalgia? And I said, do you know what fibromyalgia really is? It's a name that medical doctors made up to describe a group of symptoms. It doesn't exist. It's only just a group of symptoms. And yes, you do have those group of symptoms. So by their definition, you got fibromyalgia. But fibromyalgia and a lot of other things are nothing more than just a name. It's kind of like arthritis. So you've been taught if you got arthritis, that's a bad thing, right? And obviously, it is a bad thing. But what does arthritis mean? What does the word mean? It means painful and swollen joint. So you know what that means? When you go into your doctor and he says, well, you've got arthritis, Galen, and you say, oh my goodness, that's not good. Whereas if you would have went in and he said, you have painful and swollen joints, you would have said, I know that, that's why I'm here. But he just put it in a Greek or Latin word and changed it, and you thought, boy, he's really smart. He came up with what's really wrong with me. Sometimes us doctors are just tricky. We're not really smart, okay? So, what does peripheral neuropathy mean? Well, peripheral means away from the center, okay? And neuropathy is two words, neuro meaning nerve or nervous system, and pathy means abnormal or damaged or diseased, okay? So basically what that means is you have a nerve that's away from the center that is diseased or damaged, okay? That's what it means, okay, if you have a peripheral neuropathy. Now, here's some of the common signs, but I'm going to tell you this doesn't touch all the different things that can happen, and you'll see why in the next couple of slides, but numbness, burning, cramping, pain, difficulty walking, trouble sleeping, weird sensations in different parts of the body, especially in the feet. A lot of neuropathy start in the feet and spread to other parts of the body. And so, here's the three types of nerves that we have. And this will tell you why you have so many different types of symptoms. First of all, not all nerves in the body sense pain. That may be surprising to most people, but only about 10% of the nerves in the body actually sense pain. Only 10. You're like, well, thank God. If it was all of them, I wouldn't be able to make it. Yeah. Think about this. There are afferent and efferent nerves. So there are nerves going from the brain to the body. Those are called efferent. There are nerves going from the body to the brain. Those are called afferent nerves. Of the ones going away from the brain, none of those sense pain, because they're sending signals to the muscles and to the organs and to other things to make them work and tell them what to do. Of the afferent nerves, you've got everything from pain, you've got joint feeling, you've got pressure, you've got temperature, you've got all kinds of different things that happen besides just sensing pain. So you're only left with only about 10% of the nerves that actually sense pain. But all of these nerves can be affected by peripheral neuropathy. And you're proof of that, Russell. Okay, so sometimes you can have a sensory nerve that's affected and you may have some type of feeling change. You may have numbness, or you may have tingling, or you may have pain. Or you may not be able to feel your toe moving, which means that's going to affect your balance, okay? Which also can be affected by the motor ones. Motor nerves are nerves that are controlling muscles, or controlling muscle tendon junctions, okay? So this can affect your balance, your ability to walk, your coordination, stuff like that, right? And it can actually cause you to lose those abilities. And then autonomic, what does that mean? Well, that's going to organs. did you know that you can actually have a organ problem because of a peripheral neuropathy? One of the most common, Clement, one of the most common parts of the nervous system affected by the neuropathies is the enteric nervous system. The enteric nervous system is your bowels, your gut. So what's the most common symptom you end up with? Constipation. And it's neurologic. It's not a problem with the bowel. It's just not getting the nerve supply. So these are all important for us to know. Movement difficulties are huge. People with balance issues, and then they end up with falls, which is the #1 reason why seniors die. So this is very important that we check the whole nerve to find out what all is going on, okay? And let me say this. All chronic conditions, whether they be pain or other, all have common threads. You understand what I mean by that? In other words, like peripheral neuropathies, diabetes, thyroid problems, adrenal fatigue, all these different things that you see listed over here, fibromyalgia, vertigo, sciatica, chronic fatigue syndrome, IBS, insomnia, all of these things have common threads. And guess what? Here's what they are. They all have neurologic and metabolic problems. You understand? Something that's become now chronic. That means it's been going on for a long time. You tried some different things and it won't go away. It now is a complex problem that's going to be affecting the brain and nervous system as well as your metabolic function, which basically means your body's ability to take in food and produce energy. And so therefore, proper treatments, Russell, must involve both neurologic and metabolic. Okay? You understand what I'm saying? Because guess what? Nerves got to have a couple of things. And guess which system of your body actually demands 30% of all the energy that your body produces? What do you think it is?
Digestive.
Digestive, endocrine, nervous, immune, cardiovascular.
Nervous.
Absolutely. It's your nervous system. Your brain and spinal cord and nerves demand 30% of all the energy you produce. 30%, that's 1/3. The whole rest of the body gets the other 2/3, but that nervous system gets 1/3 of it. So guess what? If your ability to produce energy goes down because you got a weak thyroid, because you got inflammation, because you got digestive problems, because you got an anemia and you can't carry as much oxygen, you got a very poor diet and poor absorption, guess what's going to suffer first? The brain and nervous system, because it's demanding the most energy, and when your energy level drops, bad news for your nervous system. Okay? Now, here's some common causes of peripheral neuropathies and chronic pain syndromes. How about this one? I bet you didn't know this is one of the most common symptoms right here. Or one of the most common causes. Statin drugs. You know what statin drugs are? What are they for? Lowering cholesterol. I'm going to tell you why in just a second. Brain imbalances, okay, damaged back years or decades ago. This is the big one. People don't remember, I didn't do anything to my back. Well, you forgot about that fall you had when you slipped when you were 25 coming out the porch and fell off this porch or whatever. Or you forgot about that car accident that you had when you were 25 years old, or that sports injury or whatever it is. It results sometimes in stenosis, a bulging disc, or that inflamed and swollen joint we talked about. Diabetes, you know, is a huge problem for nerves, right? Insulin resistant is also a huge problem because it's the pre-diabetes. Thyroid, we talked about. Inflammation is like a blowtorch to nerves. You got inflammation, it damages nerves big time. Food sensitivities and hidden infections, okay? Now, let's talk about statins for a second because nobody knows this, but statins actually inhibit the formation of cholesterol, right? That's why you take the drug. Did you know that 80% of the cholesterol in your body is made from your liver? It's not taken in from your diet. It's not your diet is not the reason why your cholesterol is high. There's something else going on, and most of the time it's inflammation or it's infection. So, but what this drug does is it inhibits that, but you need cholesterol, by the way, for those linings to the nerves that protect the nerves are made of fat, which is built from cholesterol, and you also need cholesterol for healthy hormones and other things as well. So, you didn't know that that could be decreasing the fat in your nerves, making your nerves more susceptible to damage and pain. It also affects CoQ10, which is your energy producer. So it helps to generate, CoQ10 is used inside the mitochondria of the cell to make ATP, which is your energy source. So guess what that means? Less CoQ10 because of statins, less energy. Less energy, more pain. That's why fibromyalgia is called chronic fatigue syndrome, because they go hand in hand. Here's the studies. Statin drugs increase the risk of peripheral neuropathy 1,600% to 4,500%. You're 16 to 45 times more likely to get a peripheral neuropathy if you're taking a statin drug. You probably didn't read that on the label, but if you go read the label on the side effects and the risk, you're going to see this on there. Your doctor probably didn't mention it either, unfortunately. So here's some ideas, okay, for some treatments, and we're going to go into some of these in more detail. Number one, if you're taking a statin, you need to put in some CoQ10 no matter what. Big time, okay? Number two, you need to remove any neurologic interferences, any abnormalities, okay? So if it's a brain imbalance or something in the spine interfering with the nerves needs to be corrected. Then we must diagnose and correct any metabolic conditions like anemias, blood sugars, insulin resistance, poor diet, immune system imbalance. Did you know you can have a peripheral neuropathy because of an autoimmune condition? You can have more pain because of an autoimmune condition, like fibromyalgia. Other things can be because of autoimmune, which means your immune system is dysregulated, Anita, to the point where it's attacking your own body. That must be fixed or you're never going to get over that. Inflammation, thyroid problems, we've covered. So, pressure in the back, and then here's remove the pressure in the back, and then here's the big one we're going to talk about here in a minute, is the electrotherapy to rehabilitate the nerves. These are different things that need to happen in different cases, all right? Now I'm going to go through some steps to recovery. You need to understand the brain must fire normally. For instance, if I touch Galen on her arm, how does she know that I touched her on her arm? Or did it just look like I was going to touch her? Did I actually touch you? How did you know that?
She felt it.
How did you feel it?
How did I feel it? I don't know, my nerves or something, I don't know. Brain?
Here's what happened.
Brain? I don't know.
Here's what happened. She has Purkinje cell nerve receptors in her skin. I pressed that receptor fired. The nerve sent a signal up her nerve into the spinal cord, fired up the spinal cord into the cerebellum, crossed over at the area of the medulla into her parietal lobe on the left side of her, on the right side, excuse me, of her brain, and it said, hey, we just got a touch over on the left arm. We better send this up to the frontal lobe to see if we should do something about that. Then it fired up to the frontal lobe, and the frontal lobe said, cool out, guys. It's nothing but just a touch. We like it. It felt good. It's not pain. It's not heat. We don't have to move. We're good. No, they sent the signal back down to the cerebellum, and it said, chill out, buddy. We're good. That's how she knew I touched her. Okay, neurologically.
It happened fast.
Yeah, it did, exactly. It happens real fast. The point of that is things can go wrong in different places. Do you see that? It can go wrong here at the receptor, which can be a lot of times from blood sugar issues and inflammation. It can go wrong all the way up over here in the parietal lobe where there's decreased function of the parietal lobe, and so now it doesn't feel sensations normally. You understand the brain gets good at doing what it does. So if you've lost normal sensation to the brain and all you've been getting is sensing pain in the brain is really good at sensing pain now, but it can't feel normal sensations worth a flip. You have to retrain it. You have to and I'm going to show you that's what that's actually called in a minute, okay? All right, but so here's how the brain fires. Like we just saw, signals come into the cerebellum, they cross over to the opposite cortex, and then there's an inhibitory or excitatory stimulus down into the brainstem. And it says, go or don't go, all right? So, that happens very fast, by the way, as we learned. What happens if we get cerebellar fatigue, which is very common? Well, those signals don't happen normally, and that's the big deal. So you don't have normal fire into the brain where you can sense things. And you lose things like balance, and you lose posture and alignment because that's all controlled by the cerebellum. And you end up with neck pain and back pain and headaches and clumsiness and disorganization of even thoughts, because everything is processed into the cerebellum. Okay? So this is a common problem that we have to deal with to get normal brain function back. Okay? So how would something like this happen? Well, it goes back to one thing that D.D. Palmer said in 1895 when he first discovered chiropractic. He said, everything starts from stress. Now, there's different types of stress. There's physical, there's emotional, and there's chemical. So a physical stress could be a trauma, or it could be a micro trauma where you're doing the same thing every day repetitively. It could be an emotional trauma, or it could be a chemical. We're going to look at these, okay? But they cause the brain to fatigue because they're getting fewer nerve impulses, okay? So look at emotional traumas. Emotional traumas, so whenever you're stressed, your adrenal gland produces more cortisol. Cortisol has an effect on insulin, and it raises blood sugar. We've already said blood sugar is a bad thing for nerves being too high, right? It also raises cholesterol, LDLs, and triglycerides. And that's all from stress. So emotional stress plays a big deal in the health of your nerves and on how much pain you sense or you don't. The other thing is metabolic disorders have a huge impact on the function of the brain and the nervous system. Anemias. Do you know the brain and nerves must have oxygen, right? An anemia means that you can't carry as much oxygen in the blood as you're supposed to be able to. You can have things like something here we haven't covered is food sensitivities. So what happens there? Well, you eat a food that your body's now sensitive to, and you get an inflammatory response in the gut. The inflammatory response in the gut causes an inflammatory response in the brain. Now you have brain on fire and gut on fire. That's going to burn up some tissue. That's not a good thing. Thyroid dysfunction. How does thyroid affect it? Well, every cell in your body has a thyroid receptor. Especially the brain and especially nerves are affected when you have low thyroid. Okay, so you need good thyroid function. All right. So how do you know what's going on? There's the answer right there. Proper testing. Now here's the problem. When you went to the doctor with fibromyalgia or a peripheral neuropathy or any other kind of chronic pain syndrome, did they run any of those tests? Did they? And I'm going to show you, even if they ran the blood test, they weren't looking at the right numbers, unfortunately. And that's the problem, you see. So we're not getting the proper testing. That's part of the problem. Now here's the other one. Then you did get the blood work done, and your doc said, hey, everything in your blood work's normal. Has that ever happened to you before? Well, how frustrating is that? He's like, well, I don't feel normal. Something's not right because I don't feel right. Okay, so guess what? Here's why they say that. They only look at these numbers out here, which are called lab values. And so what they're doing is they're looking at the averages of everybody that goes in the labs. Okay? That might have been a good idea when we started doing that back in the 50s, because most people were healthy in the 50s. I'm going to tell you, right now, most people that go in the labs are not healthy. 70% of the workforce today has some type of underlying problem. And 80% of Americans have been diagnosed when they did a mineral analysis on them as being deficient in minerals or vitamins inside their body. So you've got bad averages. You're taking an average of a sick group. You're going to end up with really, really wide ranges. You understand? So guess what happens? You go into the doc, and so here's where the healthy people are, by the way. You see these functional lab ranges? This is where healthy people are. So yours come in the green section. Your doc says everything's fine, but you're not healthy. He's just looking at the wrong numbers. And so you got symptoms here, but you don't have a disease yet. But once it gets bad enough to get outside here, now you're diagnosed with the disease. Let me show you what I'm talking about. Let's take glucose, for example. So in this, we'll do a sample person over here, okay? So this person's glucose was 73. His doc said everything was normal because his range he was looking at was 65 to 110. But was that healthy? Because here's the healthy range. Does that person have healthy glucose? No. But doc said everything's okay. Then he had his thyroid ran and it's 4.2. Doc said everything's normal. But here's the healthy range, 1.3. Is that normal? No, so he's low thyroid and he has low blood sugar. Now he's got cholesterol here less than 200, okay? But they don't put any lower end number on it. It's supposed to be between 150 and 200. This guy's 148. Is he in normal? No. Triglycerides, 149. They say it's under 150, but the healthy ranges are 75 to 100. You see the problem here? So every one of these came in within normal. And by the way, anemia is a big one. Anemia, this person has an anemic pattern, but it was missed by the doctor because he's looking at the wrong ranges. Common scenario. So then what does it do? Snowball. Gets worse. You get a drug, cover a symptom, you get side effects from a drug, snowballs. Gets worse. More damage. More loss. And so we're just looking in the wrong places for the answers, guys. And so, based on your lab findings, you may have to do some things. Matter of fact, I don't take any patients that are not willing to make lifestyle changes. If you've got a chronic condition, you've got to be able to change some things. That means your diet may have to change. It may be your activity at home. You may have to take some things out of your diet. You may have to put some supplements into your diet. Cool. Putting in is always easier to do. And I always recommend you start there until you know that something else needs to come out. But sometimes you just got to get some stuff out. Okay? So how is what we do different as far as rehabilitating these problems? Let's talk about this. First of all, brain-based therapy, okay, equals basically finding where the areas of the brain are weak. So the areas of the brain and nervous system that are weak need to be rehabilitated, need to be strengthened. You never strengthen your strong points because you create more imbalance. And this is the problem with all kind of physical therapy and occupational therapy and any kind of other exercise programs. They're all based on both sides of the body, just normal global exercise. That's great if you're balanced. But let's say we had an example here with Galen where her right parietal lobe is working less. She does exercise. Boy, the left side of the parietal lobe is getting good input from this side of the body. It gets stronger, stronger, stronger. Now the imbalance between her brain gets worse. So she's trying to do exercise to make herself better, and she's actually creating a bigger deficit. You understand the problem? So what do, Anita? Well, we put activity into this side of the body to stimulate that parietal lobe. So the parietal lobe senses, it senses touch, positioning, where things are in space. So what do? We have her do nonlinear movements. We might use vibration. We're going to adjust her on this side of the body. We're going to do different therapies to wake that area up and get it working better again. Okay, you see the problem with all the other therapies, they're not centered for the problem. And then what we try to do is get this neuron firing better, and we create what's called plasticity or neuroplasticity. This word means basically the nerves are able to talk to each other better. Now that's neither good nor bad. You understand? Because if pain nerves learn to talk better, that's bad. But if healthy nerves learn to talk better, that's good. So the neuroplasticity happens based on which nerves are firing. So we fire more of the good healthy nerves like joint position, movement, muscles, movement, touch, and things like that. Sound therapy, vision therapy, different things to fire nerves that are normal and healthy. And we also use electrotherapy to fire those. And then we override the ones that are firing the pain. Does that make sense? So we create neuroplasticity. That's a big word. You need to look it up. So use it or lose it, basically. If you don't use the nerve, you lose the nerve. Nerves got to have these two things. They got to have fuel and activation. So you got to have good glucose, good oxygen, and stimulation to the brain. Brain and cell exercise is critical. I'm going to talk to you about the ways we do that. And this is some of the ones that we do. Vibration, we've talked about. Caloric stimulate, that's warm water in the ear, stimulate the cerebellum. Balance therapy, muscle therapy, the rebuilders and electrotherapy, metronome sound, cold laser stimulates cells, produces ATP, decreases pain, increases energy in the cells. And then we use this right here in the office and also at home to fire the nerves to rebuild themselves. So the more a nerve works, the better it works. Period. Bad if it's a pain nerve, good if it's a healthy nerve. Make sense? So these machines here, this is designed to fire the nerves at 7.83 hertz, which is the frequency of which healthy nerves fire. This is a great rehab that can be done at home or in the office. If you've got a compressed nerve area, you're going to have to decompress the spine if you've got a decompressed disc. You're never going to get the nerve healthy in your leg if you've got a pressure on the nerve in your back. Or the nerve's healthy in your arm if you've got pressure on the nerve in your neck. So this must occur if that's part of the problem. And then here's the big new therapy that we're doing in our office. This is the most advanced electrotherapy known today. It's HACO-Med. It's called horizontal therapy, and it was created by a German. Yeah, you can get that from HACO, okay? And he actually created the first dynamic interferential machine years ago, which was the best thing we had for pain years ago when I was in chiropractic college 20-something years ago as far as electrotherapy. But now he went way beyond. He learned some new things, and he designed a much better machine. I'm going to tell you about it and how it works. So what makes horizontal therapy different, okay, is that it is able to do something with bioelectricity, okay, and improving circulation that no other machines can do. And this is what it does. It initiates the body's natural function by two ways: electrical and chemical processes inside the body. So the body carries energy through the body two ways: in nerves and between cells. So in other words, one cell can talk to another cell directly through ion transports, okay? So the signal can be carried on ions through the cells, but also it can be carried in the nerves, right? We've never had a machine until this machine that can treat both of these nervous system problems at the same time in the same area. So this is what basically the German scientist came up with to devise a machine that runs a preset program, and it runs the whole gamut of different types of nerve frequencies. You've experienced it, Russell. You know how it changes, okay? So like it's running one for a while and then it feels different. And if you look at the machine when it's running, it'll show you the frequencies, the hertz of that it's running that nerve. So it's basically scanning the whole nerve, stimulating the whole nerve in the healthy pain frequencies. So it rebuilds it, makes it stronger and healthier so that it can not only feel better, but then be stronger in the future. So it's not just temporary relief. You understand the difference? Then, by the way, drugs work in this way. Drugs work on the chemical side of that. How do they decrease pain? Well, they decrease the chemical electrical part. They can't work on both of them, but they can numb it by decreasing the chemical electrical impulses, right? Okay, but drugs lose their effect, and drugs have side effects. The electrostimulation with the horizontal therapy actually increases and gets better over time, and it has no side effects. So it actually rehabilitates the nerve. So what are the benefits of that? Well, they're huge. Well, number one, you get this instant pain relief like you would get similar to being on a drug, okay? But it's more of a healing as well. You improve the condition that's actually causing it. You rehabilitate the muscles that are controlled by that nerves, because remember, those nerves are also controlling muscles, and you can maintain it better with these occasional treatments, okay? And here's something else. Guess what? It can be used for a lot of different things. Back pain, neck pain, we think. Knee pain is one that's very common that we use a lot. Shoulder is a big one too. Fibromyalgia. But all these other things here, even though there's one that's not up here, but there's two studies. As a matter of fact, I'm going to give you a copy of some of the studies that have been done on horizontal therapy so you can review these at home. These are just a few I pulled off of PubMed today and off the internet that are based upon some of the studies on osteoporosis and back pain. Osteoporosis can actually be improved with the electrotherapy. Okay, so I just took on a new patient today for that purpose. So what's the bottom line, guys? The bottom line is you got to take all the different pieces of the puzzle that are out of place, and you got to begin to put them back in place. You understand? And if you only address half of the puzzle, you're only going to get half of the results. You see? And then if you start to get things firing better, and then here's key, you come back and retest to make sure that everything's improving. So it's not enough just to get feeling. We want that. We want the pain to go away if you have pain, but I want the function of the nerve to improve. So we go back and recheck things, and then even sometimes re-x-ray, sometimes we redo blood work, look at things and make sure. If your blood work looks better, your exam looks better, your x-rays look better, and guess what? You feel better, you're better. Okay? You understand the difference between just than just taking a drug, which temporarily decreases the symptom and allows it to go on and get worse and give you a side effect, and you're not better. Okay? So, over time, you put the pieces of the puzzle together, it becomes a permanent fix, or as close as it can be. Some people have permanent damage. You know what I'm saying? I mean, there's not everybody's going to make 100% recovery. Sorry. There's too much damage a lot of times. But everybody can do better. I'll promise you that. Almost every case can do better. There are very few that can't, but you got to be willing to do what's necessary, and you got to be willing to I say about my ADD patients that I work with here in the office, I tell their parents you got to be willing to crawl over glass basically to do what you can to help them. And sometimes it's like that with your health. You got to be able to do the difficult thing at the beginning to be able to get the good results at the end. And so there's a couple of things that we're going to do tonight. This is the way we work up our pain patients. Of course, we do a complete neurologic and metabolic review with them. Then we go over and get a plan of what we can do, what we need to be doing, whether it's electrotherapy, or whether it's decompression, whether it's cold laser or metabolic work, or whatever it may be, okay? And then we discuss it, and we begin to go over financial obligations as well, okay? For patients, I'll tell you this, with this type of complex work, I only accept about 5 peripheral neuropathy patients at a time. The reason for that is because it's a lot of work on me and my staff. And so about a month, because the first month is very intensive work typically. After that it slows down, we can accept some other new patients. But so I'll take about 5. We started a couple this month already. We still have room for a couple more. If somebody in here or if somebody you know wants to, this is my offer. Typically, this is what I charge for the 2-day workup. If you do it here from the workshop, I charge you $100. If you pay for it tonight, I'll give you a 50% discount. You'll pay $50 for the first 2 visits, okay? And I'll review your blood too, but normally I charge that just to review your blood. So, it's a good deal. If you need it, if somebody you know needs it, sign them up. Here's my rules though, before you sign up. You must be willing to make serious lifestyle changes. Again, as I said, if you don't waste your money, and I certainly don't have the time to waste if we're not going to get results. I don't want to do that. Number 2, you got to take accountability for your health. Remember, we went back to the beginning. The choice is yours, okay, and the responsibility is ultimately yours. And here's the thing, that means that guess what? Insurance and Medicare is only going to pay for a small portion of the type of care that we do. You know why? I've been in practice since 1992. They haven't added any new services to Medicare or insurance companies that I know of since 1992. So any cold laser, they don't cover. Decompression, they don't cover. Okay, Hocomed, forget it. You know what I'm saying? I mean, they're not. What you get for insurance is basic bottom line health care, and that's why we got the problem that we got. But let me give you an example how bad this is, okay? When I do my diabetes talks, I ask people this question. How long have you been a diabetic? 1, 2, 10, 20, 30 years. How long have you been seeing the doctor you've been seeing? 10 years. How much have you improved since then? 0. Guess why you're still seeing that doctor? Because insurance pays for it. There ain't no way you're going to reach in your pocket and pull out money to go and pay somebody that ain't helping you for 10 years, are you? So insurance really just promotes bad doctors staying in business is what it does, unfortunately. So, but today, if you're going to get good health care, you're going to have to pay for it because here's the dilemma. I'll give you an insight of it from a doctor's perspective. 1993, I got on my first PPOs, Anita, okay? I got paid about $42 to $43, sometimes $44, $45 per visit. That's what they were allowing back then. Pretty good deal, signed up for that, got on the program, helped a lot of people. It was a blessing. Well, now we're 23 years later. Those same insurance companies now allow me $23 to $24 for the same treatment. Went down $20 in 20 years. Now, do you think my overhead went down in 20 years? Did anything else go down in 20 years? So you understand why you can't get quality health care? Because the doctors are dependent on insurance. They got to see twice as many just to pay their bills. You want to know why he don't sit and talk to you? Because he can't. There's no possible way and pay his bills if he's depending on insurance to make his bills. You understand the problem that we're in. So it ain't going to get better as far as insurance goes. But, so here's the bottom line. There's things you need to be asking yourself about these chronic pain syndromes. You know, right now you might say, oh man, mine's a 5. On a scale of 1 to 10, my pain's a 5. Great. I can live with that. No problem. Okay, my next question. Where are you going to be in 3 years? It's not going to be the same. And it's not going to be better if you don't do anything. So what about, how's this affecting your relationships now? And do you think that's going to get better or worse? Your ability to enjoy life. So what things would you be able to do better if you didn't have pain or loss of function? A lot of things. So see, that's a big one right there to me, is loss of quality of life. And then on a scale of 1 to 10, you got to be at least an 8 up there to really get a good improvement. Okay, and then of course, like I said, if you're not an 8 or higher, if this type of level of commitment, you're just not ready to start the program. But I want to answer a couple of questions. I had one patient that asked me on Facebook, or one person asked me about drop foot. Let me answer that. Remember what I said about different types of nerves, sensory nerves, autonomic nerves, motor nerves. When you have motor nerve problems, you can have spasms or you can have loss of function. So spasms, you know what those are. Loss of function is what happens in drop foot. Okay, so now a person has slap foot, where when they walk, this foot slaps down, or they can't raise their foot, and so they walk like this because they can't raise their toe up. So it depends on which nerve it is. L5, they can't raise it up. S1, they can't slow it down. Or L4, they can't slow it down too. Both can do that.